Okay, we have two more people joining us. So, why? Okay, we already have our first question. Amazing. Why you were drawn to dentistry? Do you feel like you have the chance to give back and help people? Oh, nice. Sure, I'll keep this in mind to answer. At first, I'm gonna go through the. Sophie, by the way, thank you so much for your question. Yeah, I'm gonna go through the presentation first. It's probably gonna take me like a 5 to 10 minutes. After that, I'm gonna go through the questions, and again, try my best to answer your question as to the best of my abilities. Okay. Okay. So again, thank you so much for FutureMeMD for hosting this talk. I'm always happy to help. There has always been people before me who have helped people like me who were in pre-dental to get into dental school. So I'm always really happy and passionate about giving back and trying to do my best to share my experience with my fellow pre-dental students. Okay, so as I mentioned, my name is Nima Ligvan, and I was born and raised in Iran, and I immigrated to Canada with my family after finishing high school when I was 19. My hometown is Toronto. My family lives in Toronto, but currently, since I attend Western University, I live in London, Ontario. I like many of you and my classmates. I do not come from a family of doctors, whether they're physicians, dentists, pharmacists, or veterinarians. And since I was always been surrounded by civil engineers, architects, I initially really wanted to pursue a career in architecture. Not civil engineer, to be honest, but definitely architecture. My academic experiences. So for undergrad, I attended University of Toronto St. George campus from 2015 to 2019. As you all know, it's just a typical four-year program for my bachelor's degree. I double majored in immunology and human biology. Currently, I'm a first-year DDS candidate. I just actually today we finished our first year officially. I'm a DDS candidate at Schulich School of Medicine and Dentistry, class of 2023. And I'm currently the Vice President of Research for Federation of Canadian Dentistry Student Associations. Basically, FCDSA, Federation, is the student body of Canadian Dental Association governing over 10 dental faculties and all the student bodies across Canada. My DET experience. I took DET once, and I got a decent mark, but to be honest, I cannot always talk a lot about my experience when it comes to DET. Of course, I'll try my best to share it with you all. But yeah, I just took it once, the Canadian DET, in November of 2017, when I was starting my third year of undergrad, because I wanted to apply in my third year to U of T. I studied for only a couple of dedicated weeks, but it was very intense, very focused. It was probably in October when I really hammered down just to study for DET for a couple of weeks. Given that I had a very limited amount of time that I could study for DET, I only focused on one resource. It was the Princeton Review textbooks for DET, and I was really happy with the textbook, and I will absolutely answer more detailed questions if you guys had any at the end of the talk about DET. My extracurriculars. Well, like many of you all, and we have all done a lot of stuff, but I think the most relevant ones to dentistry would be that I was a research assistant at the University of Toronto Faculty of Dentistry and Mount Sinai Hospital Department of Dentistry and Oral Surgery Clinic from 2016 to present. Even right now, even though I'm at Western, I'm still active in research projects going on at U of T. I was the former president of the University of Toronto Pre-Dental Society and an executive member of multiple other campus clubs. I also played some intramural soccer on the side for my college at U of T, and I was also part of a very small local strings orchestra as a violin player. My application writing experience. I only applied to two dental schools, U of D and Western. For U of D, the first time that I applied, I was in my third year, and as you all know, right now it has changed slightly, but U of D doesn't have a lot of documentation, a lot of like personal statements or anything. So in my third year, just randomly applied because it was like a 5 minutes application, and I actually got an interview. But second time when I applied in my fourth year undergrad, again, U of D was the same system, but Western already needed several documents, for example, autobiographical sketch and a personal statement, plus a few dentistry related questions that were basically trying to pick your brain to see what is your understanding of dentistry, whether you just shotgun applying to dentistry or you actually have a decent understanding of dentistry. And since I was only focused on Western, even though the questions were not necessarily super difficult, it were just really simple questions, nothing too complicated. So I really had time to focus on and draw school's attention to my life experiences. About my interview experience. So as I mentioned before, the first time that I applied for dental school, I was in my third year, and I actually had and I actually interviewed at U of D. Unfortunately, I got waitlisted. But the reason I think, looking back, I got waitlisted was that I wasn't prepared at all. I really just, winged it. I was in my third year. I was like, okay, if not this year, maybe next year. I didn't take it seriously, but I wish I could because I was just like probably 3 spots away from getting in off the waitlist. In my second cycle, which was in 2019, I was graduating in my fourth year of undergrad. And at first, in February, first week of February of 2019, I interviewed at U of D, got waitlisted again. But that time, I feel like I was maybe too prepared. I was a bit too robotic, now that I remember. And basically, I wasn't really genuine enough. Even though at the time I was thinking that, oh, I'm nailing these questions, I'm giving them proper answers. But well, when you finish your interview and go home, you sit down and think about the answers you've given. And at the time I knew that, boy, I thought I was ready, but apparently, it didn't feel right. And actually I got waitlisted as a result too. But 2 months later, in April 2019, I interviewed at Western Dentistry. Because of my experiences, I really, really, really tried to be as genuine and honest and relaxed as possible. And well, thanks God I got in directly, not from the waitlist. Not that is a bad thing necessarily, but I feel like that approach of being more genuine, more friendly, more relaxed, really, really, really helps with your chances of getting in, because people sitting in front of you are actual human beings from different backgrounds, and they will really appreciate your, your attitude, your positive attitude during the interview. So, general tips. This is, of course, my tips. Of course, anyone could have different experiences. These are all based on my journey through undergrad when I was applying for dental school. So tip number 1, if you're in general considering a career in healthcare, whether it's medicine, dentistry, pharmacy, whatever it is, try, in my opinion, try your best to get as much exposure as you can in the early years of your undergrad education. Because don't start your education thinking that, oh, I only want medicine, oh, I only want dentistry, or I only want pharmacy. I'm not saying that keep that door open throughout your undergrad for all 4 years, or if you're doing a graduate degree, during your graduate degree as well. I'm just trying to say is that try different things out. You never know what you like more. I got the opportunity to get exposed to dentistry very soon, and I really, really liked it. So that worked out well for me, I guess. So don't try to leave it for too late, but at the same time, try to get exposure to different fields of healthcare It's an amazing, amazing field to be in, whether you're a physician, whether you're a dentist or a pharmacist. They're all noble, very, very, very satisfying careers. So you're not going to be doing anything wrong by choosing one over another, but it's just some of them would potentially fit your personality better, in my opinion. Tip number 2. This again might not necessarily apply to everyone, but again, as I mentioned before, try to narrow down your range of interest as soon as you can. So after you get exposed to different areas of healthcare, for example, and you say, okay, I shadowed a physician, maybe or two, I shadowed a couple of dentists, I've talked to some pharmacists, I've been to the pharmacy a few times, and I've worked there, I've volunteered there. So by the time that you do that, in a few months, maybe like a year or so, you hopefully will know what are your preferences, which career fits your personality better. And as soon as you find that out, try to basically cross those that are not necessarily your favorite and narrow your range of interest. This will really, really, really help you to spend your time and resources more efficiently. Tip number 3. This is, the optimal situation. And now that you've attended this talk, probably you're in this group. If you know that dentistry is your main goal, and well, congrats, try your best to get involved in dentistry related activities. It doesn't need to be something huge. It doesn't need to be something groundbreaking. Anything that basically shows the admission committees that, yes, I'm not just shotgun applying to dentistry. I actually am interested in dentistry. This, again, does not mean that you should let go of activities and hobbies that you already enjoy, because being well-rounded is what exactly all the admissions committees are looking for. So again, try your best to get involved in certain dentistry-related activities, but if not, if you don't want to focus 100% on it, it's absolutely fine, as long as there's just something that shows that, oh, I have shadowed some dentists. Maybe there is this dentist-related club or charity or something that I volunteer for. It doesn't necessarily need to be something big, just anything that shows some interest to begin with. Tip number 4, which is very, very important for me, and it was actually, I think has been, it's my favorite tip, I guess, is that try your best to shadow and talk to as many dental professionals as possible. Whether they're just university profs, they're in academia, whether they're not teaching at all and they're only focusing on their private practice. And doesn't really matter if they're general dentists, they're specialists, just try to get as much exposure as possible. It is very important. And as I mentioned below, maybe especially when you're applying to Canadian dental schools, because they don't require a certain amount of shadowing hours. But I mean, it's versus US, which is a bit more mandatory. Like some schools basically have a minimum cutoff for shadowing hours. But just being there, shadowing dentists, talking to dentists from different walks of life, you wouldn't believe how encouraging it is. All those people have been in your shoes back in the day, so they can definitely give you good tips to where to go, where not to go, what to do, what not to do, how to spend your time, what to focus on, what not to focus on. And this, I imagine, if hopefully you guys will someday get into dental school, the knowledge that you gather from talking to all of these dentists from different backgrounds will definitely pay dividend when you're actually in dental school. Not that it's not going to help you get in, but it will probably be even more fruitful when you're actually in dental school. So yeah, that was my very quick presentation. And here is my LinkedIn and Instagram handle. If you wanted to follow me, if you had any questions outside of here, I'm always available to answer your questions. There's always been people who have helped me get into dental school. So I'm always very, very interested and happy to help anyone else who's considering dentistry. and is applying or is struggling, I'm always happy to help. Okay, I'm gonna go through the questions in the Q&A. I'm probably gonna start with the, sorry. Q&A. So the first question was from Sophie, which is, why were you drawn to dentistry? Do you feel like you have the chance to give back and help people? Well, again, it's never been a overnight decision, I guess. It's always been something that has been gradual. But as I mentioned before, I had the opportunity to actually shadow a bunch of healthcare professionals. And the since I do not necessarily come from a family of dentists, so it was my first exposure. And one field that really, really, really attracted my attention to was dentistry. Since, I mean, I personally had braces on and I've had my wisdom teeth taken out. So I've always had a good relationship with my dentist, my orthodontist, and my oral surgeon. So maybe it was a good beginning that led to this. But to answer whether whether it gives you a chance to give back, it definitely does. You won't believe how much even the smallest treatment that a dentist can provide for a patient, even the smallest caries, even the smallest tooth pain that you can help the patient alleviate that pain, that concern, you wouldn't believe how impactful it is. Going to dental school, you might think that, oh, it's just dentistry, it's just your mouth, it's nothing serious. But when you actually go see patients, when you actually go shadow dentists, you realize firsthand that, oh my God, this is amazing. A lot of work is being done across Ontario, across Toronto, that I am aware of when it comes to dental charity. So if you really, really, really want to be encouraged even more about dentistry, I highly recommend you guys go and shadow or volunteer for any of those charities. You will have a better understanding of what it takes to be a dentist and how impactful you are in the lives of your patients. I hope you have answered your question, but again, I have to move on to next questions. If you had more questions, Sophie, please feel free to reach out to me on Instagram, on LinkedIn, however you felt more comfortable. Let me, okay. Oh, no problem, no problem. So let me see. I don't see all the questions for some reason. Sorry, guys. Leo, do you know how I can see the Q&A, the questions? I don't see them at all.
Yeah, if you go, hi guys, this is Leo from FutureMeMD. You go to the bottom, does it not show Q&A at the bottom? Like, isn't there a section called Q&A?
Oh, wait. Actually, I just saw it. Oh, beautiful.
Oh, do you see it?
Yes.
Perfect. Okay, perfect.
Okay, thank you.
No problem.
So, okay. So the first question is, okay, what was your first year average? And I did kind of rough in some of my courses in my first semester, and I don't know if I will be competitive enough as an applicant. Okay, to answer this question, I happen to have a relatively high GPA in my first year, but this does not necessarily mean, I mean, a lot of friends that I have, even right now in dental school, they did not necessarily have the highest GPAs ever in every year, depending on the dental school that you're applying to. And a lot of them basically have policies who show some sort of like a advantage to students. Basically, they might say that okay, we will only consider your top 2 years, or we will consider, or we will probably drop the worst credit of of each year. There are always some ways to improve your GPA. Your GPA is not always as bad as you think. We undergrads, we're always like freaking out and, oh my God, what is my GPA? Is it competitive enough or not? Also, it is very important to do a quick search on Canadian, or if you're interested in US dental schools, to see what is their GPA and what is their requirement, what is the class average. It will definitely give you a better understanding of how competitive you are. But if you have a hard time in first year, it's absolutely fine, because everyone goes through that. It's not just you. And don't be hard on yourself. Just if you think that you know what has gone wrong, try to use it as a learning experience, and just move on. Just learn from that, and hopefully for future. Oh, did you guys hear the first answer I gave? Okay. Hello, Leo. Do you hear me?
Yep, I'm here.
Did you hear the answer to my first question?
Yeah, I did.
Okay. Okay. Beautiful.
Yeah, I think it's some people were having issues, but I think
Okay, so if someone didn't hear this, the question was about first year average and whether we will still be considered as a competitive applicant if we don't have necessarily a high GPA in our first year. And my answer for that is that don't be hard on yourself, because you have many more years to come, and you can definitely bounce back. And also many dental schools have some policies that allow for you to have some hiccups here and there. Some of them would ask for the best 2 years of your undergrad. Some of them would probably drop the worst credit of each year. So don't really worry about it. Just do a quick search of each dental school's website. They will clarify their requirements when it comes to GPA. So what was my GPA and DAT, please? Okay. Different schools, whether you're applying to Canada or US, have different cutoffs. So just try to do your best, and don't really think about, oh, what is the average, what is the cutoff, or just try to do your best. My DAT was it was 3 years ago. My academic average was 25-ish. I'm not 100% sure, 24, 25. My perceptual ability test, PAT, was 21. So I hope I answered that question. And my GPA, depending on how you calculate it, was 3.90 plus. So OMSAS. Next question. What kind of language did you use during the interview? Like, do you have to use big words, or were you yourself, if that makes sense? This is a very good question about whether we should be ourselves or we should use big words. Well, it really depends on the question. Depends on the scenario that you're talking about. If the question is actually somewhat more formal, then you also have to act more normal, more serious. Sometimes, for example, you're asked to give someone some bad news. In that scenarios, you have to, of course, show the appropriate level of emotional expression. So I would say in general, try to be as genuine possible. And how you can do that, you have to know your own story. Don't try to be just someone that has been portrayed on YouTube videos about interviews, or here and there in like forums that you hear, oh, be like this, answer like this. No, just be yourself, but be the best of yourself. Be as genuine as possible. Know your life stories. Know what your accomplishments are. Know where you come from, and that really helps. And it will definitely show on how successful you've been, how competitive you are, how much of a passionate person you are, how compassionate you are when it comes to helping people. So using big words necessarily would not be necessarily a good thing if it's out of context, but if for example they ask you some questions when it's a bit more healthcare related, for example, the current situation in dentistry, the water fluoridation, this kind of stuff, of course you have to be aware of certain topics, and when you're discussing them, of course you have to use the proper words. But besides that, don't try to be using too many big words if that helps. But again, yeah, let me know if you have more questions. I'll be happy to help. Next question. English is my second language. Any advice? How did you study for the reading? Okay. So same here. English is also my second language. I came to Canada when I was 19 and went straight to university. How did you study? I guess being in an undergrad, after a few years, you automatically level up your reading skills, I guess. And it's very different when you compare it to when you just started speaking English. But, well, I don't know your level of English, but I assume you're pretty well. Since you're in undergrad, you're probably a competitive student. I would, again, recommend, if you really are concerned about your reading skills, please, please, please start as soon as possible. Start on that material, whatever the company it is. I don't want to do an ad for advertisement for any of the companies. Any of the companies that you feel more comfortable with, start with them. It doesn't really matter which company you go with, in my honest opinion, just to start. And it will definitely help in the long term. If you're really concerned about it, start from today, basically. Next question. How did you get a position in dentistry research during undergrad? Well, this is a very, very long story. Basically, as I mentioned before, I did my undergrad back in U of T. I was not necessarily hoping to, I wasn't aiming for research in dentistry. I mean, it would have been nice. But at first, I applied for a research position at Mount Sinai Hospital, Pain Management Center. And in my initial interview, they had two interviews, basically. The first interview was like a general interview. They just wanted to gauge your interest and your knowledge and your personality, basically. And after that, based on your answer, they would assign you to different physicians or specialists. Little I knew that one of the investigators that they were helping with some of the projects was actually a dentist, and to be more detailed, an endodontist, which is a specialist of root canal treatment. And I mentioned in my first interview that I'm really passionate about dentistry and I'm aiming to become a dentist one day. And they were like, oh, this is your lucky day. Actually, one of our investigators is looking for a research assistant. Do you want to work with him? I was like, hell yeah, I would. So I had a second interview with this guy. He's one of the endodontists at the U of T Faculty of Dentistry. And that was how I started my position. But I'm pretty sure there are a lot of ways and there are a lot of positions available for undergraduate students who are passionate about dentistry to get involved, whether it's clinical dentistry, whether it's lab-based basic science. I'm 100% sure if you apply, just go through their website, Mount Sinai's website, Faculty, Department of Dentistry. If you're in Toronto, I don't know if you are, but any Faculty of Dentistry across Canada, I'm quite sure that there will be positions available for undergrad students. Of course, it will be a little bit more difficult to get them because the priority is pretty much always with dental students. But if you're persistent enough, I'm 100% sure you'll find someplace. What did you look about dentistry? So the question is, what did I look about dentistry? It is a somewhat personal question, not that I'm not comfortable talking, but I mean, my answer could be very different from someone else's. But for me, I guess, first of all, as I mentioned before, the whole field of dentistry was something really, really new for me. So anything that I faced, anything that I learned about dentistry was such an amazing experience. It was something fresh, something that I had never encountered before. It was amazing. So that from the get-go was so interesting, and it definitely draw my attention to it. But also when you dig deeper into dentistry and what it takes to be a dentist, you realize that yes, it's a lot of investment. It's very expensive in terms of education. 4 years. I mean, it's a lot of debt. It's somehow, backbreaking debt, but it's all right. It's a very good career. I have never basically come across any dentist, whether general dentist or a specialist, who is nagged about being a dentist, to be honest. So it is a very good career. It has a lot of opportunities. People, it's a misconception, I guess, about dentistry being a very, very, very narrow field. But when you actually start dentistry, you realize that, oh my God, there's so much that you can do. You can become a general dentist, but do everything. You can become a specialist. And there are like 9 different specialties in dentistry that you can do. It is a quite wide field. So next reason would be that it has the best balance of a career, having a career, and your lifestyle, your private lifestyle, which was a very huge deal for me. But again, if you're more into, focusing on your career, maybe dentistry would be, to be honest, a bit boring for you. But if you're actually looking for something which is quite prestigious, it's something that is satisfactory, it's you giving back to society, you're helping a lot of people with your practice, and have your own balance of life and your job, then dentistry is for you. The next question is, what was your CGPA, if you don't mind sharing? I answered this question before. My CGPA, I'm not 100% sure because I didn't calculate it myself, but I'm 100% sure it was around 3.99, something like that. Not too high, not too low, somewhere in the middle. I'm like, in our class, I'm average at Western. One more question. What strategies did you use to make yourself a competitive applicant, stand out from the others? One general rule about dentistry, especially from what I've heard and seen from my classmates and everything, there is no one formula for becoming a competitive applicant. Yes, you have to have the basics, which are, in Canada at least, your DAT and your GPA. If you have these two, you'll get an interview and you're good to go for now. But when it comes to interviews, or whether certain dental schools have different requirements, like if they ask for personal statements or biographical sketches. So in that situation, you just have to draw on your life experiences. Just bring in everything that you can talk about. It doesn't really matter if it's about dentistry or not, as long as it shows what kind of a person you are genuinely, it will do the work. Trust me. Like I took the academic road. I did a lot of research. I did a lot of leadership in dentistry, but I know a lot of people in my class who didn't do anything necessarily dentistry related. One of my best friends right now at Western, she was a restaurant manager for like 3 years before she applied to dental school. After she finished undergrad, she went on out of school. She was a restaurant manager, didn't do anything about dentistry, but right now she's in my class and she's going to be a dentist in 3 years. So there is no one strategy. There is no one formula for becoming a dentist. As long as you show passion, you show that you're a compassionate person, you're a kind person, you're a social and well-rounded person, you're good to go. What type of things did you list in your autobiographical sketch? As I mentioned before, my application was very traditional. It was just basically, oh, I did this leadership, I did this research, I did this publication, I did this, blah, 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 blah. But it does not necessarily need to be like that. And besides that, I really gave them a good story of my life, where I started from, how many times I immigrated, twice, by the way. Just my life story, basically. And it was a perfect opportunity for me to, actually, even, it was just a perfect self-reflection opportunity for me to talk about myself, talk about where I come from, my family, my education. It is fun actually writing your autobiographical sketch. I spent a decent amount of time on it. Please do that. Don't rush into it. Don't rush it at all, please. It is very important. They really to read them. Don't think that they don't read them. They actually read them. So yeah, just be yourself. Just bring out the best in yourself. Just that. Don't try to lie in it or exaggerate or anything. Just be the best that you can be. Next question. If we want Western to only count our last 2 years of uni, do we apply after we have finished 4 years? So no, let's say you're in your 4th year, right? And you want to apply. They will look into the best 2 years out of your 1st, 2nd, and 3rd year. But they will require you to finish your undergrad and also have a minimum GPA of 3.0 of your 4th year. Because technically when you are applying, they're not looking at your 4th year undergrad GPA, but when you basically graduate and want to basically register as a dental student, they will ask you for your final year GPA. So yeah, if you're applying your 4th year, they will just look into your 1st, 2nd, or 3rd and pick the best 2. Doesn't matter if it's 2 and 3 or 1 and 3 or 1 or 2. Doesn't really matter. How did you get involved and seek out opportunities? It's basically just it is kind of frustrating at first, I'm not gonna lie, but do your best, talk to as many people as possible. If you could get a hold of dental students like myself, I did that, and talk to, like, shadow a couple of dentists will definitely help out, and they will give you a better idea of what kind of opportunities is out there. And if there's any like campus groups related to dentistry, join them, like Operation Smile, different dental charities, your pre-dent, whatever the university you go to, your pre-dental society as well. Next question, did you write manual dexterity test? No, I did not. And to be honest, it's very obsolete right now. I don't think many dental schools actually require you to write MDT. But again, do your research, find out which schools actually require it. And it's not that difficult from what I've heard. And some schools actually really need a very, very, very low mark. So you don't need to stress it. Just do your research, to see which universities actually want MDT, and go from there. Sometimes they want it, but you're not applying to that university, so you don't need to take it. Any tips for getting a high GPA in undergrad? Study skills, time management? Whoa, this is a loaded question. High GPA in undergrad? Well, it really depends first in your program. In my opinion, it might sound a bit, not heroic, but don't be a hero in undergrad when you're trying to get into professional schools. Just try to get a high GPA, be smart about what courses you take, and study skills. I personally never had a specific study skill necessarily to talk about, but when it comes to time management, I've definitely had like a very detailed calendar of what I did, what I had to do for each course, and just classic stuff, traditional, nothing too specific, just boilerplate. Try to be on top of your notes, try to be on top of your lectures, and also try your best to find some good study buddies. God knows how much they help you. And also try to find people who are probably more hardworking than you are, because they'll push you. It will be a bit frustrating at first, but it will definitely help you. Next question, what do you recommend is the best way to ask someone if you can shadow them? Well, in Canada, unfortunately, it's the topic of shadowing a dentist is not as well established as it is in the United States. And right now, because of the COVID situation, I don't think any dentist is gonna accept you as a shadowing student. Whereas hopefully, fingers crossed, as soon as this COVID-19 thing stops, you can definitely go back to dental offices. Just call them up. It's not a big deal. Some dental offices don't have just have a policy that they don't accept shadow students, that's fine. Call another one. You will definitely find one dentist near you that will accept shadow students. Just don't expect it to be too long. There's maybe a few days. If he's too or she is being too nice, maybe a week or so. And to be honest, since we are undergrad students, we're not gonna be learning too much necessarily because we're just watching. We don't really know the basics of dentistry. So just try to talk to different dentists if you can. Like maybe a week here, a week there, different dental offices. Unless they're so nice that they just want you to hang around, hang out with them and just stay around, then that will be perfect. But besides that, try to, reach out to as many dental offices as possible, both general dentists and specialists. Next question. What are some things you've learned since you started dental school? Well, first thing, dental school, it's so humbling. We all started dental school thinking that, oh, we were the smartest people ever. We were on top of the world, blah, 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 blah. 1 month in, we were all crushed. Dental school is very, very, very demanding. No disrespect to my medical student colleagues, but when it comes to the undergrad education of medicine versus dentistry, I have right now, a bunch of my friends are medical students. The medical school part versus dental school is a bit more challenging, I guess. But the difference is that after medical schools, you have to go through residency, and that's extra couple of years, which is brutal, absolutely brutal. I can tell that Leo can vouch for that. It's very difficult. But for dentistry, especially if you want to become a general dentist, after 4 years, you graduate, and after the day after you graduate and you have your license, you can work. So you don't necessarily need to go through extra school. And the reason it's so demanding is that after 4 years, you have to be ready to see patients and to be seeing real life patients. Not that you don't see any patients in dental school, but you're actually out there practicing dentistry in private practice. It's very different. So it is very demanding. It's very difficult. And all of those skills that you learn in undergrad will definitely come in handy. For example, as I mentioned before, time management. It's absolutely necessary because in dental school, first year, at least at Western, I'm pretty sure it's pretty much the same in different dental schools. We have classes 9 a.m. to 5 p.m. every day, except for weekends. So you barely have time. And we also have one break, like in half an hour to 1 hour break from 12 to 1 or sometimes 12:30 to 1:30. So it is very intense. And by the end of first year, and when you go to second year, the whole second year, you're pretty much always in sim clinic, which it is very tiring, physically tiring. So yeah, it's fun, but it's very, very demanding. And yeah. Next question. What are some things you wish you knew prior to entering dental school? Honestly, I wasn't that much surprised. I had a lot of dental school friends. So I kind of had a good understanding of what dental school would be. Of course, it turned out to be a little more difficult than I imagined. But to be honest, I don't think I'm the right person to answer this question. But in general, I would say maybe try to be, I don't know, I really cannot answer this question sorry for that. I'm gonna move to the next question. How is it different from undergrad workloads? So undergrad is very difficult, especially when it comes to the stress side of it, because you don't know whether you're gonna get into medical school or dental school or pharmacy school or grad school. It's very challenging. The anxiety kicks in and you're like, oh, what am I gonna do after life sci, after undergrad, right? So, and also the courses are horrendous too. You're going to lab, you're going to lectures, everything is new in undergrad. But dental school is kind of different. You have more courses. For example, this year we had 16 courses instead of 10. And you're spending much more time in dental school, early in the morning to the evening, like 5, 6. Like today, for example, It was an exception, but normally I would come home at 7 p.m. It is very difficult. It is very difficult. So I would say the workload, content, everything is more. The only good thing about it is that, especially if you want to become a general dentist, you're not necessarily are aiming for super high marks and super high ranks. You just have to pass and you will become a dentist. And there is no anxiety of, oh, whether I become a dentist or not, or whether I become a physician or not, or I'm a pharmacist. It's a bit more calming than, okay, I'm already in dentist. I'm going to be a dentist basically one day. Which dental charities are you specifically referring to? So there are a bunch. There is like this free dental clinic run by City of Toronto that you can look up. I'm pretty sure they're always looking for volunteers. I've been part of Operation Smile in Toronto. I was the president of the U of T chapter. We donated some money, we had some fundraising ideas and here and there. And also there was this project in Toronto, in Eglinton, Toronto, called Phoenix Smile. They basically helped out homeless women who have been victim of domestic violence at times, and another charity that helped with transgender women who are also like victim of any sort of violence, and they provided them with free dental workup, and not just normal cleaning or those kind of stuff, more dramatic like implant dentistry, denture, more serious. And actually helping that charity really, really, really was one of the experiences in my undergrad that really pushed me towards dentistry. Actually, the second day that I helped with them, I was actually interviewing this transgender woman who was there for a full arch denture, both upper arch and lower arch. And after she saw her dentures, she just burst out crying because she was 24, but because of so many health, medical, and social issues that she had lost pretty much all of her teeth, and the 3 teeth that she had left were grossly necrotic. So they took them out, put implants in, 2 dentures, upper arch and lower arch, and she burst out crying. It was such a life-changing moment that it was at the same time, even though I did a very, very small part in that treatment, but it was very, very satisfying. I was so happy that I was part of it. Next question. How do you manage your time wisely to stay on top of dental school while still having life outside of a school? Well, basically your life outside of a school is your life inside of a school, because pretty much all of your friends turn out to be your classmates. So be best friends with your classmates in dental school. And you're always spending time with each other. You're like a small family. I mean, Western, we're a relatively small faculty. It's just 56 of us. I mean, U of T is bigger, it's 96. But pretty much other dental schools across Canada are also like around 50 to 60. And it's a pretty little family. And we're always hanging out together. Of course, there's some cliques here and there, some groups, smaller. It's not like all 56 of us hang out with each other all the time. But you spend a lot of time in dental school, but also if you already had some hobbies from before dental school, now you have transferred them into dental school and you can spend time enjoying them, basically.